Well, good afternoon.
Hello.
I was looking at trying to explain to everyone a little bit of the challenges that someone faces when they have jaw joint problems. Could you describe a little bit of what that's like and your experience and history with jaw joint problems?
The first time I noticed a problem, I was a freshman in high school, so I would have been about 15. And for me, it started with a very sharp, sudden pain in my right jaw, the right of my jaw. And from there, it affected everything from my eating to sleeping to just daily functioning, because it would affect the tension in my muscles to where I would get headaches, and anytime I felt stressed in any way, it would get worse. It really would determine the quality of my days pretty significantly. Mm-hmm. And now I'm almost 24, and so it's going on 9 years that I've had that struggle.
Has it gotten better or worse throughout that time?
Started off being much worse than it is now, and I've been through so many treatments since then that it's kind of done a curve.
Okay.
The treatments, should I mention?
Yeah. What was the first type of treatment you went through? If you could describe that for me.
I'm trying to remember back that far.
Mm-hmm.
Well, I had chiropractic work to where I would go and I would get the I don't know what it's called anymore.
TENS unit?
Yes. I would have adjustments done on my jaw, my neck, my back, my body, I guess trying to affect the joint. I went through acupuncture. I had braces on a second time. This happened after the TMJ started after I had my first set of braces. And then I had another pair of braces on. I was told that shifting the way my teeth were might have helped my bite.
Right.
And had those on for about a year and a half and had them off, and it didn't particularly help me. Mm-hmm.
Did it improve the way you could eat at all when you had the braces the second time?
I remember that it improved the way my jaw could open. I think my bite opened a little bit more after that. Mm-hmm. But eating mostly has always been a problem for how tense my muscles can get. Not necessarily sharp pain.
Okay.
So, yeah.
So, prior to the orthodontics the second time, you had braces the first time. Following that, you noticed that you had this jaw pain started. Then you had the second round of braces, and it helped with how much you could open. How much could you open originally when this first started?
Very little. I would say I remember hearing the 2 fingers type opening as a reference of measuring my bite.
Right.
And I also remembered another detail. It's hard to remember over the span of so many years when these things happen.
Certainly.
But I remember when it first started, it only was in one side of my jaw, and over the years it shifted to where it was affecting both sides.
Okay.
I don't remember when that happened.
Gotcha. But it did happen
Yeah.
throughout the course of the treatment. All right, so you had the second set of braces done. Didn't get a lot of relief. You were still having the stress and the headaches and muscle aches and everything. What was the next course of action? What did you do following that?
Well, when I went to college at the University of Vermont, I moved up to Burlington, and that's when you referred me to Dr. Crandall, the Orofacial Pain Associates is what their office is called, and he did X-rays and measurements and very detailed notes about how far it was opening, feel my jaw and make notes about the clicking and the cracking, and even detailed notes about daily life, stress levels, caffeine intake, sleep, number of hours a night.
Certainly.
And made me decided that the best course of action was a splint to wear on the top of my teeth, 24 hours a day. I would just take it out to brush it and clean it. Had to eat with it in and everything. And
how is that?
Very frustrating to have it in all the time, hard to adjust to, but it definitely helped significantly with the tension my muscles were feeling.
Excellent.
Because that's always been my number one complaint, has been how tight the muscles in my face feel. And I'm constantly, to this day, kind of opening my mouth like I'm yawning, stretching constantly, trying to stretch them out.
Sure.
And that helped significantly to start with that problem. But the problem with it is that when I would take it out, it would immediately I would feel that tension come back.
Okay.
And it was scary for me to think about what if this breaks and I'm on vacation somewhere, or what if I lose it? You know, how am I going to get through even a day without it? So that was one of the downfalls with the splint.
Okay. But while you were wearing it, it provided comfort, but without it, you were essentially back in the same boat.
Yes.
Okay.
Exactly. Even taking it out to brush my teeth, I would start to feel the tension in my muscles come back for just that few minutes.
So it was an instantaneous response. Wow. Okay, and so you wore the splint for how long a period of time?
I want to say almost 3 years. I'm going on 3 years. Yeah.
That sounds about right.
Yeah. It started to, one thing I noticed is that every time I would go in for an appointment, I would, within days, crack the same spot on the back of it, top, the left of the splint in the back. And they would tell me, depending on the break, I would either need to come and get it repaired or not, based on how big the crack was. But I noticed that every single time I would go, I would get it fixed up, and then I'd come home, and 2 days later I would start tasting plastic in my mouth, or whatever the material is that I would bust out of it with my teeth.
Okay, so it sounds like it was not being, it wasn't a good long-term solution for you.
No.
All right. So what happened after that?
Well, I started coming here. Well, I've been coming here forever, but you were talking to me about the benefit of maybe adjusting my teeth as well, which was something that I don't think the doctor in Vermont, although he did a great job, didn't particularly agree with. I'm not sure why. But then we came here and you decided to put a crown in and change kind of the terminology.
That's okay. Just basically the way your teeth met.
Yeah. And to shape a new type of splint for me that would be hopefully something I could wear just at night and not constantly.
Okay. So prior to that, if you could describe your levels of discomfort, experience sensitivity, stuff like that, and then we'll look at how you're doing at present.
So it was exciting for me to have this happen a few months ago because I was at the point with the old splint where new problems were starting to come up. So the first few years I had it, things were kind of kept at bay and kind of on a steady line. They weren't 100% better, but they weren't getting worse. And then over the course of the last year with it, I started noticing that it was just excruciating to not have it in for any amount of time. I was starting to get like a catching, sharp, painful experience a few times a week when I was eating, even with it in. It felt like my bones were catching together. And I was having extreme sensitivity on my upper teeth, especially up here. And so that was becoming very frustrating to me when I thought, you know, how's this going to get better?
Right.
And then so in the past few months of wearing the new splint, which is just at night or when I'm feeling stressed in the daytime where I'm clenching, it's amazing that the sensitivity up here has completely been reduced. It's still there, but it's significantly better. Cold isn't as difficult for me. Sweets aren't as sensitive for me.
Sweets?
Yeah. And having the splint in only at night has also been completely fine. So during the daytime, I don't feel, unless I'm particularly clenching my teeth, I don't feel that immediate tension in my muscles like I was with the other splint when I would take it out. And it's just been a huge help to not have it in my mouth constantly too.
That's great.
Yeah.
But after 3 years of wearing that splint day and night, even when you were eating, that must have been a big leap of faith to go to.
Yeah, I was terrified. I was really scared. I think I asked you a few times, you know, are you sure? Because the first few days I had it, I was pretty apprehensive about not having something in my mouth constantly. I was really nervous, actually. But within a few days, I noticed that nothing terrible had happened. I didn't have horrible tension in my jaw. I didn't have any painful sharp pains happening. Oh, and the sharp pain too I've had almost no experience with that since getting the new splint too.
Excellent.
Which was the most intense side effect that I was having before that. And I was getting worried that the way it was, that was going to start becoming the norm.
Sure.
So it's nice that it's not.
And where are you as far as headaches go, as compared to where you were before?
Much better. I would say I don't notice them as much as I was. The only time I'll get them is, again, if I'm at work and start to clench my teeth and notice that I'm, you know,
You're working
I
on
should
it.
have brought my splint with me to
Okay.
work, you know. But headaches are pretty manageable.
Excellent. So, to recap, what we've done for you is take you from the chronic use of the splint to adjusting your bite so that your teeth interact with one another a little bit better, and making a splint that you would only wear at night, so the likelihood of breakage is much lower. It's less stressed, and it's also balanced to accommodate your teeth the way they are. And it sounds like that's working out fairly well for you.
It is. It's complete 180 from the other splint.
Excellent.
Yeah.
Absolutely terrific.
Yeah.
Great. Well, I'm so glad that this has worked out, and
I'm
thank you.
very excited about it.
Cool. Thank you so much for your
Thank
time.
you.